My name is Thurea Mwadzaya, a freelance journalist in Coast, Kenya. I write on well-researched stories focusing on health matters, fitness, wellness, public safety, among other human interest stories. As a freelance writer, I've been able to work for more than 5 years in the journalism sector, where I have mingled with a variety of audiences. So by now I know what they need and how to follow up stories. I have worked on print, radio, television, as well as online media. My education background fits the journalism profession since I have a diploma in mass communication as well as a degree in journalism and mass communication. As a journalist, I have done numerous follow-up stories. For instance, I have been able to rescue a 3-year-old girl that was about to be sold by her mother since the mother could not afford keeping her. I rescued the girl, took her to Mombasa County Children's Officer. Thereby, the child was in custody of the Mombasa County Children's Home. I've also helped a 3-year-old girl in Kwale County to be able to get her operation waiver since she was born without anus, and that situation was very bad for her. Her family could not afford that kind of money. Through the follow-up story, Wema Center came in and paid the 500,000 Kenyan shillings. It is through networking that journalists are able to grow and mentor other journalists in the communities. In joining the CGTN Media Challengers, I'll be able to focus more on journalism. Since CGTN is an international media house, I'll be able to network and know more in the journalism sector so as to enrich my stories. People living with HIV in Kenya have expressed concerns over emergence of stigmatization as the country faces acute shortages of ARVs. The HIV patients who earlier escaped stigmatization in their communities by taking ARVs in their neighboring towns say that frequenting hospitals and getting less dosages of the ARVs by the rationing due to the shortage will make the communities know their status. According to the Ministry of Health, the number of new HIV infections remain high, close to 560,000 cases. 1.6 million people are estimated to be living with HIV in Kenya, with stigma and discrimination being identified as one of the major barriers access to HIV testing. The HIV Stigma Index 2014 report shows that HIV stigma and discrimination is high with marked variation. As Kenyans battle COVID-19, people living with HIV and AIDS are worried as their immunity is lowered and some are scared that they lose their lives. Reporting for CGTN, I'm Thurea Teryane Mwadzaya.